Doctor, thank you for having me in the practice.
Yeah.
I must say that I'm absolutely impressed. I got to listen into some of your treatment coordination, talking with your different patients, special needs, your care factor and such. So I got a question for you. I mean, I can tell the amount of attention, care, energy that you put into each and every patient. I want to hear about how challenging is it and how rewarding it is.
The challenge is just the time that it takes, because I do want every person to feel like that they were given the adequate amount of time. And not just that, but also getting them to experience just how much I really do care for them. The challenging part is I have other patients and I want to give them all the same amount of time as well. Just keeping on that type of pace is what makes it challenging. But the rewarding part of it as well is that my patients to me are more than just clients or patients. We do really become family when they step into my practice. It's like a family reunion every time I get to see them enter my door. I love getting to hear about their lives and just how things are going. And then even at times where if things aren't going well, then getting just to sit with them and cry with them or pray with them and so getting to celebrate the wins, but also getting to mourn with them in the losses. It's rewarding because I'm not just working on strangers, but I'm getting to work on people that I love and care for.
I love that. And I saw it and I heard it.
Cool.
Very impressed. And not just you, your whole team. Yeah. I mean, it really, what you and Gloria have created here, I mean, it really resonates down. So well done on that. I want to talk about how important this is. Can we go over there and this view?
Let's do it.
So you've got this, you're sitting here and you're treating patients and you got this.
Oh, I know, it's serene.
It is. Would you say it actually is a contributing factor to the vibe that is created of comfort? Tell me about that.
100%. So part of what our practice specializes in is patients who have high anxiety and also special needs. And there's just something about just natural lighting in the outdoors that is just therapeutic for anyone. Part of what is unique about our practice is this just beautiful view that we get to enjoy every day. Every day I walk in here, even for myself, it does not get old getting to see this view.
Right.
And even the wildlife that even roams through here, even though it's a golf course, we get to see a lot of that, and patients get so excited to get to see a deer, a turtle, or a goose. I always love to hear the reactions that when they step through the threshold of our reception area into our clinic, every time they're like, whoa, what a view. We hear that all the time. So it has really become kind of like a staple of our practice.
Awesome. Last thing I want to ask about. So I saw special needs. I saw young patients. I saw people, towards the end of their life, and you were caring for everybody, all shapes and sizes, all ages, and then full mouth. I saw full mouth rehabilitation, like large cases. So, maybe you could just touch on what can you do? It sounds, from what I saw, just about anything, but tell me a little bit about your skill set and where that goes and where that ends and what you don't do.
So it's very important for me to be able to offer my patients a comprehensive plan that gets them to full vitality and health. For me, when I was in my education within my schooling and residency, I wanted to make sure I gained the broadest skill set. And even now, after, post-school, I still continue, I look to see, okay, what are the needs of my patients? And the skill sets I add to my repertoire or to our practice are ones that are gonna continue to better serve our patient population and really make our practice a home for patients. Like I mentioned, people who have high anxiety, it's hard just to step into the dental office on its own.
At all.
So when they learn to trust someone, if I have to send them somewhere else and they have now got to have to trust that person,
over again, right.
I'm just creating more barriers for them to getting healthy. It's very important for me that not only am I providing a broad range of services, but I'm providing it at the level of a specialist. For me, it's a matter of caring to the person to the utmost highest of standards. We are capable of almost anything within our practice. I mean, our youngest patient was 2 weeks old. Our oldest was 103.
Wow.
It is important that we're able to care for all shapes and sizes and ages of people. There does come a time where we can't.
Sure.
I am not a specialist and I'm one person. And so when I see a patient and I feel like there's a situation that maybe, I could handle it, but it would be better in the hands of a specialist, in the best interest of the patient, I will recommend them and refer them to that specialist.
Great. Can we walk through and just see some of the different operatories?
Sure.
So lead me through.
All right, come on, follow me. Follow the yellow brick road. No, I was kidding. So we have 6 operatories all together. 2 of our operatories are assigned to hygiene to service those patients. And then we have 4 that are meant for doing treatment. But really they're kind of interchangeable and we plug in wherever we're needed. And we even have portable equipment. If we need to go to an operatory that's not normally designed for hygiene, we can make it fit and customize it to fit hygiene. That way we don't have to delay a person's care.
Great.
We have 6 altogether, and every single operatory minus one has the beautiful view of the golf course, and that way patients can always get to enjoy that. So the one operatory that doesn't have that view is usually the one that we use for when people are sedated, because when they're sedated, it doesn't matter to them whether they can see that view or not.
That's great. Tell me about the importance of your team. I see the amount of time you put into training the team. I saw your morning huddle this morning. I see what you do throughout the day. Tell me about that. I mean, I've got to meet all your great team members. We're impressed. So how'd you do that?
That's a wonderful question. So I like how you started by, you asked, tell me about your team. So that word team is very important to me. A lot of times within the industry is very common to say staff. I've always liked to joke around and say, well, to me, the word staff makes me think of an infection. Whereas I like I like the term team because to me, it builds unity.
Sure.
Adds to the culture. Staff to me is like there's like a superiority, whereas I feel a team is more unifying. Same thing, like when I invite someone to come work at our office, I ask them if they will come work with me versus come work for me. All of those things just come down to like the foundation of the culture that we want to establish here. Culture is everything to me. I'm one person and I cannot do this alone. We have such a great mission and great vision as to how we want to care for people, because that's what we're here for. It's more than just dentistry for us, and so it's so important that I have a team that also shares in that same culture, that same vision and mission. For me, it's exciting that I get to come alongside these amazing individuals and get to care for our patients. There's just something about when you get to share in the reward, right? It's like, it's one thing to receive a gift for yourself, but then when you get a gift that you can share with others, it's just so much more enjoyable, and that's kind of how I feel about my practice.
Well, hats off to you both, because in less than a year, you've taken your practice to about 3 times the size.
Yeah.
So well done to you guys. Well done. Good work.
Well, thank you. Appreciate it.